Hi, my name is Erika Pustizzi, and today I will be talking about the low FODMAP diet and IBS. To get started, we'll go over a few terms to get familiarized with. First, starting off with IBS, which stands for irritable bowel syndrome. IBS is a gastrointestinal disorder affecting the large intestine, meaning the colon. Some symptoms that come along with IBS are abdominal discomfort and pain, altered bowel habits, meaning constipation or diarrhea, bloating, gas, and changes in stool appearance. There's actually no exact cause that has been proven to cause IBS, but some factors that can trigger symptoms include changing gut bacteria, inflammation, genetics, as well as stress and diet changes, so a lot of environmental factors. Another term to get familiar with is FODMAP. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. FODMAPs are short chain carbohydrates, meaning sugars that the small intestine absorbs poorly, and there are multiple foods that are high in FODMAPs, low in FODMAPs, and people that are really good at explaining this specifically are registered dietitians. Because these carbohydrates are absorbed poorly, they pass into the colon where they can be fermented by gut bacteria, leading to gas production, water retention, and bowel distension, which is the reason for causing all that abdominal discomfort. And then the fermentation process can result in the digestive symptoms associated with IBS. So I'm specifically talking about the low FODMAP diet. The goal of the low FODMAP diet is to eliminate food high in FODMAPs, only needing to restrict the foods that trigger symptoms, so not restricting all carbohydrates, just the one that might trigger these symptoms. The low FODMAP diet consists of 3 phases. There is the elimination phase, reintroduction phase, and maintenance phase. These 3 phases are used as guidelines to cut out high FODMAP foods for a certain amount of time, slowly add some foods back in, and then assess what foods work for you and what foods don't work. By eliminating and reintroducing certain high FODMAP foods, you can better gauge which foods are triggering your symptoms and which ones aren't. And in some cases, there might be multiple high FODMAP food groups that are triggering, or only like 1 or 2. So this leads to my overall research question, which is, does following a low FODMAP diet help manage symptoms in people suffering from IBS? To do this, I researched 3 articles, 3 different studies that helped provide some evidence. So starting off with Article 1, titled Low FODMAP Diet Reduces Irritable Bowel Symptoms in Patients with Inflammatory Bowel Disease. This article was written by N. Peterson, along with many others, published in May of 2017 by World J. Gastroenterol. This type of study was a human clinical study, and the goal of the study was to investigate the effect of a low FODMAP diet on irritable bowel syndrome, so IBS-like symptoms in patients with inflammatory bowel disease. To do this, they received patients with mild to moderate IBS symptoms, and they were assigned to 2 different groups, one being normal diet and one a low FODMAP diet. And this went on for 0 weeks. So between 0 to 6 weeks, patients completed an IBS severity symptom survey and a short IBD quality of life questionnaire. So results collected that at week 6, the low FODMAP diet group showed a significantly lower median of the IBS severity symptom survey than the normal diet group, which is shown in this graph up above, meaning that the symptoms were less severe than the normal diet. And then on the right, the other graph, we have that the low FODMAP diet group had a significantly greater increase in the SURE IBD Quality of Life questionnaire. So this meaning that people in the low FODMAP diet group had a greater outcome in the questionnaire than the normal diet group. My next article, titled Low FODMAP Diet Relieves Visceral Hypersensitivity and is Associated with Changes in Colonic Microcirculation in Water Avoidance Mice Model. This was by C. Hugh and a few others. This was published in February of 2023, so pretty recently. So the overview of the study, this was an animal study, actually studied on mice, and the goal of the study was to hypothesize that IBS pathogenesis might be related to abnormalities in colonic microcirculation. A low FODMAP diet could alleviate visceral hypersensitivity by improving colonic microcirculation, so working hand in hand in the study. The method used here was that they collected 6 mice that were raised to establish an IBS-like rodent model using water avoidance stress or sham water avoidance stress as control, and this was done 1 hour per day for 10 days. Things that were recorded were body weight and food consumption of the mice, and then visceral sensitivity and colonic microcirculation were measured and assessed. So after the study, this leads us to our results. The results show that a low FODMAP diet decreased colonic microcirculation perfusion and decreased the threshold of visceral hypersensitivity, which supports the goal of this study, supporting that they work hand in hand, also decreasing those symptoms of IBS, causing things in the stomach to work more properly. And then this leads me to my last article, titled Low FODMAP Diet Reduces Gastrointestinal Symptoms and Irritable Bowel Syndrome and Clinical Response Could Be Predicted by Symptom Severity, which was a randomized crossover trial. This was written by J.P. Allegra and studied by J.P. Allegra along with many others. The study was done in December of 2022, done by Clinical Nutrition. This type of study was also a human clinical study. The goal of the study was to compare the effects of diets with low versus moderate FODMAP content on GI symptoms and bowel habits. To conduct the study, they gathered adult participants with IBS. They were divided, included, and adhered to 2 7-day diets with either low or moderate amounts of FODMAPs. And then these periods were separated by a washout period. The things that were used during the study to carry out the results were an IBS severity scoring system and a stool diary. And these were completed before and after the diet periods. And these bring us to our results, meaning or showing that after a low FODMAP diet, there was reduced overall GI symptom severity, abdominal pain intensity and frequency, bowel habits dissatisfaction, and daily life interference, as well as more firm and less frequent stools, but not after moderate FODMAP diet. After collecting all of these studies and doing research, this brings me to my conclusion that following a low FODMAP diet will not cure IBS, but it is proven to help manage symptoms along with many other lifestyle changes. And this is proven especially by these 3 studies that I researched. In all 3 studies, there was shown to be a positive outcome with the low FODMAP diet on IBS symptoms. It is highly recommended that people who are going to start following a low FODMAP diet seek help from a registered dietitian, where they can better assist in what foods are high and low in FODMAPs. It is not recommended to pick and choose what foods you think will be high or low in FODMAPs just by some prior knowledge. So seeing a registered dietitian can really help with this issue. And that concludes everything for my presentation. So thank you for watching and listening. And yeah.